glute medius. Now, what is that muscle? It's a pelvic stabilizer. It's probably the muscle that I treat the most in clinic. I'll often do something called a Trendelenburg assessment, where I'm looking at the back of the body to see how the pelvis shifts when you stand on one leg. Glute medius is also responsible for, can be responsible for lower back pain. So if your left side glute medius is not doing its job, then your right side QL will take over. The body is great at compensating, perhaps not always the way we want it to. The typical exercises that people will do is they'll be laying on the floor, so the floor's here, and they'll do hip abduction, so straight leg, or they might do clam, where they do this. Clam and the straight leg raise, both are quite challenging because we can compensate, we can dump through our pelvis, we can not lengthen the ribs. So this is a really nice exercise. These are just 2 yoga bricks that I probably got from Amazon or a supermarket at some point, and they want to be on the floor. And then you've got a really stretchy band. Now it's key that you've got a very loose band or a weaker band, because this is quite hard work. If you've only got one band, then see how it goes. But if you get any irritation around here or around here, you probably need to get a weaker band. You can use the long band, so you just need to tie a knot in it. So the bands go around the midfoot, and the feet come inside the blocks. Move myself back so you can see me. Good. We're going to step up onto the block and then down again. Now this is a very purposeful movement. I'm deliberately doing this slowly because I want to activate this muscle, and to activate this muscle I've got to go outwards. Now I favour my right leg, when in reality the issue is in my left leg or my left hip. So when I step back down again, I'm going to go to the weaker side. So I'm going to step up with that side first. And that's it. That's all we've got to do. Step up, step down. You want it nice and controlled. You don't want to be going like this, because that won't do anything. So nice and controlled movement. 10 or 15 times once a day. See how it goes. If you've got any questions, you know where I am.